Don't miss these 8 early cancer signs, it could save you. Cancer is the second leading cause of death globally, which is indeed a sobering fact. However, there's hope. Early detection and treatment significantly increase the chances of overcoming it. Detecting cancer early is one of the most effective strategies in the fight against this illness. That's why recognizing the early warning signs is crucial. We've compiled a list of 8 symptoms that should not be ignored. Understanding these could genuinely save lives. This is the second video in our series. If you haven't watched the first part yet, make sure to check it out once you're done with this one. It's packed with valuable insights you'll find incredibly useful. Before diving into the symptoms, let's take a moment to discuss what can cause cancer. In the United States, scientists have identified the 4 main preventable causes of cancer: cigarette smoking, excess body weight, alcohol consumption, and insufficient physical activity. Additional factors that might increase risk include a diet low in fruits and vegetables or high in processed meats, as well as certain infections like HPV. Alarmingly, about 4 in 10 cancer cases are linked to these preventable factors. Of course, there are unchangeable risk factors too, such as genetics and aging. Even so, it's worth noting that 2 people with similar lifestyles can have very different outcomes. One may develop cancer while the other does not. Researchers are still trying to understand why this happens. That's why staying vigilant and keeping an eye out for symptoms is so important. Make sure to like this video, subscribe to our channel, and let's get started. 1. Mysterious of pain. Pain functions like an internal alarm system, a signal from your body warning that something isn't quite right. It could be the sharp sting of a broken bone or the dull ache in your back after lifting heavy boxes. Pain serves a purpose. It urges us to stop, pay attention, and address our needs. However, pain isn't always straightforward. Sometimes it persists without a clear cause. You're not lifting heavy objects or exerting yourself, yet that unrelenting ache just lingers. When pain refuses to subside, it's time to consult a doctor. One of the potential, and often silent, culprits behind persistent pain is cancer. But how does cancer cause pain? There are several mechanisms at play. Initially, cancerous tumors develop quietly, but as they grow, they begin to exert pressure. This pressure can affect bones, nerves, or organs, leading to a constant, nagging ache that disrupts your daily life. Beyond physical pressure, some cancer cells release chemicals into surrounding tissues. These substances act like alarms, heightening sensitivity in the affected area and triggering pain signals that serve as a persistent sign something is wrong. Then there's metastasis, cancer's ability to spread from its original site to other parts of the body. As it establishes itself in new areas, it can cause pain in unexpected places, complicating both diagnosis and treatment. This spreading amplifies discomfort and often affects multiple regions, making pain management more challenging. The severity of this pain varies depending on factors like the type of cancer, how far it has spread, overall health, and even individual pain tolerance. Research shows that advanced stages of cancer are more likely to cause significant pain. However, pain is deeply personal. What feels tolerable to one may be unbearable to another. This variability underscores the importance of listening to your body. Persistent or new pain, especially if it doesn't seem to have a clear cause, should never be ignored. Trust your instincts and seek medical advice when something feels off. 2. Excessive weight loss. Weight fluctuations are a common part of life for most of us, whether due to changes in diet, exercise routines, or life stages such as pregnancy and aging. We've all experienced the ebb and flow of a few pounds. However, what if you started losing weight rapidly without making any deliberate effort? That's not just unusual, it's a potential red flag. Imagine stepping on the scale and discovering you've lost 10 pounds or more without changing your diet or increasing your physical activity. Sudden, unexplained weight loss like this isn't typical and may indicate something more serious, such as cancer. Cancer cells share one critical trait: they grow uncontrollably. This rampant growth can hijack your body's energy supply, making you burn more calories even when you're at rest. This phenomenon is surprisingly common. Research suggests that between 31% and 87% of cancer patients report significant unintentional weight loss. This symptom is particularly associated with cancers of the pancreas, stomach, esophagus, and lungs. If you're losing weight for no apparent reason, it's essential to consult your doctor promptly. 3. Difficulty in swallowing or a nagging cough. Another issue to watch for is persistent difficulty swallowing or a nagging cough. It's normal for swallowing to feel momentarily challenging, like when a pill gets stuck or a piece of food isn't chewed properly. Usually, it's harmless. But if this becomes a recurring problem, especially if accompanied by indigestion, it could signal that something isn't quite right with your esophagus. These subtle signs might point to esophageal cancer. When indigestion arises alongside these swallowing difficulties, it's definitely worth bringing up with your healthcare provider. Likewise, a persistent cough that refuses to go away can be concerning. This could be an early warning sign of lung cancer, which often begins subtly with symptoms easy to dismiss as minor irritations. If your cough lingers or your voice becomes hoarse over several weeks, it's time to take action. Hoarseness can also be linked to tumors situated near the vocal cords. Even small, non-painful growths in this area can affect your voice, making it sound strained or raspy. In a way, your vocal cords might be signaling that something deeper is going on and requires attention. 4. The lump you can't ignore. Let's discuss lumps and bumps. During a routine checkup, you suddenly notice a lump that wasn't there before. It's natural to feel alarmed and wonder what it could mean. Unusual lumps or swellings can indeed be concerning. While some may be benign, others might indicate something more serious, such as cancer. Conditions like breast cancer, lymphoma, or various other types of cancer can sometimes present as lumps. The presence of a lump signals that something might not be right, and it's essential to act promptly. Early detection significantly improves the chances of effective treatment. Diagnostic tools like mammograms or biopsies can help determine whether a lump is malignant or not. Don't delay or ignore the situation. Getting these evaluations done as soon as possible is critical for your health and peace of mind. 5. Unexplained fatigue. Everyone feels tired sometimes, whether it's after a long day at work or a fun-filled weekend. Who doesn't look forward to collapsing into bed? But the type of fatigue we're discussing here is something entirely different. This isn't about needing a quick nap, it's an overwhelming exhaustion that persists, no matter how much rest you get. Surprisingly, nearly 40% of cancer patients report experiencing severe fatigue at the time of their diagnosis. This condition, known as cancer-related fatigue, CRF, is not your typical drowsiness. CRF leaves you feeling persistently drained, weak, and completely devoid of energy. What makes it especially tricky is that it can begin long before cancer is diagnosed and often continues throughout treatment. So, what drives this relentless fatigue? Cancer cells are notorious for hijacking the body's nutrients to fuel their growth and survival. This process depletes your body of the nourishment it desperately needs, leaving you feeling utterly worn out. Unfortunately, even plenty of rest or sleep doesn't seem to alleviate this kind of exhaustion. That said, it's important not to jump to conclusions. Fatigue can result from a wide range of issues, many of which are entirely unrelated to cancer. However, if you notice that you're constantly exhausted without a clear explanation, and it starts interfering with your daily life, it's a good idea to get it checked out. 6. changes in bowel and bladder habits. Let's talk about a topic we all experience but seldom bring up: bathroom habits. While it might seem mundane, what happens during your bathroom routine can reveal important insights about your health. If you notice something unusual, like changes in the color, odor, or frequency of your urine or bowel movements, or even the presence of blood or other irregularities, it's worth paying attention. Often, these changes are minor and temporary, possibly linked to diet or dehydration. However, persistent or significant changes might indicate something more serious. Conditions like colorectal, bladder, prostate, or cervical cancer can sometimes present early warning signs through altered bathroom patterns. If you're experiencing such symptoms, don't ignore them. Taking the time to consult your doctor can help rule out serious issues and ensure any potential problems are addressed early. 7. Sores that don't heal. 7 sores that don't heal can sometimes serve as silent alarms for underlying health issues. Imagine dealing with a sore, whether on your skin or inside your mouth, that simply refuses to go away. What might seem like a minor inconvenience at first could, in reality, point to something more serious. Take, for instance, ulcers on the nipple. While these may be harmless in some cases, they can also signify early breast cancer. Similarly, sores on the skin that fail to heal could be an early warning sign of skin cancer, like unwelcome guests overstaying their welcome. When it comes to sores inside your mouth, things can become even more subtle. A persistent sore might appear as a white patch that can't be scraped off or as a lingering red area. Both could indicate oral cancer. This is where regular dentist visits play a crucial role. During checkups, ask about oral cancer screenings. Dentists can identify changes in color or texture and check for unusual lumps, acting as an important ally in early detection. 8. Weird skin changes. Our skin acts as a personal weather radar, constantly sending signals about what's happening both inside and outside our bodies. Paying attention to your skin isn't just about aesthetics, it's a crucial part of maintaining overall health. If you notice anything new or unusual, it's important to discuss it with your doctor. Think of your skin as a living canvas, always changing and adapting. However, certain changes, such as a new mole or a spot that looks noticeably different, can signify more than just surface-level issues. These could be early indicators of skin cancer. For those at higher risk, scheduling an annual full-body skin cancer screening with a dermatologist is a wise preventative measure. So, who is considered at higher risk? This group includes individuals with fair skin, red hair, more than 50 moles, or those who have spent significant time in the sun or used tanning beds. A family history of melanoma or a personal history of skin cancer further underscores the importance of these yearly checkups. If you've noticed any of these symptoms, try not to be alarmed. Does it mean you have cancer? Not necessarily. Symptoms like these can result from various health conditions, many of which aren't as serious as cancer. The important thing is to remain calm and take proactive steps. Think of these symptoms as your body's way of getting your attention about something it needs. The best way to understand what's going on is to consult your doctor and undergo the necessary tests. This step is essential. It gives you a clear answer and allows potential issues to be addressed early. Now, let's consider the worst-case scenario: receiving a diagnosis of cancer. Does this mean it's the end of the road? Absolutely not. Here's the good news: advancements in medical research and technology have significantly improved cancer treatment. Many people today lead longer, healthier lives even after a diagnosis. Early detection plays an integral role, acting like a secret weapon. It offers a huge advantage by making treatments more effective and less invasive. It's similar to being in a battle and knowing all your opponent's moves in advance. That's the power of early detection. Regular screenings and checkups are essential tools for spotting cancer early, turning what might have been a crisis into a manageable situation. If you found this information helpful, consider liking this video and subscribing to our channel for more valuable content. Don't forget to check out the videos on screen for additional insights. Thank you for your support.